Hello.
Yes.
Okay, that's great. Okay, so today we are going to discuss a really important topic. I would say really high yield, and and most of the students find it like really difficult to navigate through the questions on their exam or on their UWord. That's going like the topic is going to be asset-based regulation, right? So it's considered to be, I would say, like one of the toughest topic of USMLE. So I'll just try my best to make it as simple as I can. Okay, are you guys here with me? Hello, hello.
Yes, we are
Yes,
listening.
yeah. Okay, good. So you guys should just turn on your mics, and today we are going to have a discussion, right? So I'll be asking you some questions that how does this change occur, what's going to be, so you have to use a lot of your brain. Okay, so just keep that in mind. So just give me a second. Okay, so let me just share my screen first. Okay, can you guys just see my screen? Hello.
Yes.
Yeah.
Okay, good. So today we are going to be talking about the acid-base physiology. So I'll go through each and everything, like, as I already mentioned. So it's considered to be one of the toughest topic of USMLE, but I'll just make it, as simple as a piece of cake for you. Believe me, if you guys are with me, if you guys are following me, if you are participating, that's my promise. In the end of this lecture, you will be master of all of those MCQs which appear on acid-base regulation or acid-base physiology. Okay, so the first thing which we are going to discuss is what is acidosis, what is alkalosis, right? So can anyone just tell me what is the normal pH of our blood?
7.35 to 7.45.
Okay, perfect. It's 7.35 to 7.45. Okay, so whenever the pH is like higher than 7.45, what do we call that?
Alkalosis.
That's
Alkalosis.
alkalosis, right? That's alkalosis. Whenever it's more than 7.45, it's alkalosis. Whenever it's less than 7.35, it's
Acidosis.
acidosis. Okay, because in the pH formula, if you see, there is basically a log of H, right? So basically decreased pH means that you have more H plus, you have more acid. Just keep that in mind, right? So it's a kind of inverse proportion with H plus, right? So pH have basically an inverse relation with hydrogens, right? Whenever the pH is less, we simply assume that it's an acidic environment. There is more H plus. More H plus mean more acid, right? Hello?
Yeah.
Okay. And on the other hand, when the pH is like more than 7.45, it's an alkaline environment. You would just assume that there are more of, alkaline things present. And one of the main alkaline thing is going to be your HCO3 in your body, right? Keep that in mind. So it's acidosis whenever we have more H plus, whenever we have less H plus. Less H plus, on the other hand, simply mean that you have more alkaline environment, right? Environment is more alkaline. You have more alkalis there, right? Because we already know that acid and base normally occurs in a proportion, right? They are present in a balance. If we are disrupting that balance, right, it means we are increasing one thing. Like, for example, you have H2CO3, right? It would just dissociate into H plus and HCO3. H plus is an acid. You already know that, right? While HCO3 is a base. You already know that. Okay. So whenever I'm increasing the acid, there's basically a balance present between them. Okay. When I'm increasing H plus, it's obvious that HCO3 is going to go down. On the other hand, if I'm decreasing H plus, it's obvious that the concentration of HCO3 is going to go up, right? So everything in our body normally is in a form of a balance between alkalis and balance between acids. Is that clear? Hello?
Can
Yep.
you repeat that?
Okay. So normally we know that carbon dioxide is acidic. If you guys know, right? CO2 is acidic. It produces acidic environment. How? Carbon dioxide basically react with H2O in the presence of an enzyme that is carbonic anhydrase, right? And in the end, it's going to give you H2CO3. Am I right? Hello? Hello?
Yes, yes.
Okay, okay. Please answer me, okay? So what happens if you have HCO3, the main component present inside your blood, inside your body? So normally it is going to dissociate into H plus, hydrogen, and HCO3. We know H plus is acidic, hydrogens are acidic, right? Like all of the acids in the end give you H plus. All of the acid in the end give you hydrogen plus, right? And we know that HCO3 is basic, right? All of the bases, if you have in your body in the end, are going to give you HCO3, right? So you can see if we have one molecule of H plus on the same hand, in order to neutralize it, in order to balance it, we have one molecule of HCO3. Am I right? Hello?
Yes.
It means that if you have two molecules of hydrogen, normally we should be having two molecules of HCO3 in order to have a proper balance, right? If we
Yeah.
have three molecules of hydrogen, at the same time, you must be having three molecules of HCO3 in order to keep things balanced. For example, if I'm only increasing the H plus, that is, if I'm having 4 molecules of H plus, without disrupting this value, 3 molecules of HCO3, won't we be having an acidic environment now? Because we have an extra H plus, and all of the acid in the end give us H plus. It's going to be an acidic environment, right? Am I right? Because you have one extra H plus. That's an acidic in nature, right? All of the acids in the end give you hydrogen plus. Am I right? Hello?
Yes.
Okay, so can I say whenever I increases H plus, what's going to happen to the pH? pH is going to decrease because they have inverse relation, right? Inverse relation.
Yeah.
Okay. On the same hand, let's just check the same scenario. If we have 3 hydrogen plus, and if you have 3 HCO3, okay. Now, if I'm decreasing if I'm removing one H plus, now I have 2 H plus and I have 3 HCO3. Okay, so isn't it a basic environment? Because now we have, as compared, the balance is disrupted. Now we have more HCO3, which is a base, as compared to that of acid. So now all of the environment is going to become alkaline, right? Hello?
Yes, it will
Okay, and what would happen to the pH? pH would
increase.
increase. So the pH have inverse relation with H plus, but it have direct relation with your HCO3. If HCO3 increases, pH increases. It's like more alkaline environment. Is that clear? Hello?
Yes, it is.
Yes,
Okay.
yes.
Okay, perfect. So as we know that we already discussed that CO2 basically it gives us an acidic environment, right? Acidic environment, right? Because it would just give us H plus and HCO3, it would just give us, like, it's more acidic, right? And we know that CO2 is a major component of our body, right? Because we all know that our tissues make CO2 in the end from all of the oxygen which we are taking, right? And all of the food which we are consuming through respiration, to in the end we are going to be having a lot of CO2, and our lungs are then going to expire it out into the environment, right? So can I say that CO2, okay, so the main controlling machinery, okay, in order to make CO2 in a proper environment, in a proper concentration, our lungs basically play an important role in that, right? Am I right?
Yes.
Okay. So can I say that somehow our acid-base balance involves the activity of our lungs? Can I say that? Lungs are involved in order to change any acidic or basic environment. You know, lungs are the main machinery which control your CO2, right? Your carbon dioxide in turns, play an important role in acid-base physiology. So lungs can control your environment, your acidic or basic environment inside your body. Can I say that statement? Hello?
Yeah.
Okay. So lungs are involved in controlling your acid base physiology. Let's just make it simple. Okay. Okay. On the other hand, you guys know that in your kidney, if you guys know, remember the function of aldosterone, right? What was the function of aldosterone, if you guys remember? It's going to reabsorb your Na. It's going to excrete out your H plus. Remember, it's going to excrete out your K plus. Remember?
Yes.
Hello. Okay. Perfect. Okay, and it's also going to, if you guys remember, it reabsorb HCO3 in your proximal convoluted tubule, your kidneys. Remember? Your kidneys normally reabsorb HCO3 in the proximal convoluted tubule. Remember?
Yes.
Okay. For example, if the function of aldosterone increases, it means that it's going to dump off more hydrogens, right? If more hydrogens are dumping off, if I'm removing the hydrogens, you guys can see here, what happens? We are going to be having a basic environment, right? Because we are disrupting the balance between acid and bases, right? Normally, it must be in a proper balance, right? Hello?
Yes.
Okay, so can I say that increase aldosterone activity? Okay, we have a condition we already discussed. What's that? Crohn's disease, right? What happens in Crohn's disease? You have a tumor kind of thing which is going to release a lot of aldosterone, and in the end, what is it's going to do? It's going to dump off a lot of H plus, and whenever a lot of H plus is being dumped off, you are left with the alkalis. So the environment is going to become alkalotic, right? You're going to be having alkalosis, right? More basic environment. So can I say that kidney also helps in modulating your acid-base physiology?
Yes.
Can I say that? Okay, in different ways. For example, if I need, for example, let's suppose, if inside our body I have more of acidic environment, as we know, the two things are going to help me maintain the balance. Let's suppose, okay, I'm just giving you an, a kind of scenario that, for example, if we have an individual, he's having acidic environment inside his body, and we want to correct that. So two things are going to come into play: your lungs, your kidneys, right? So how your lungs is going to compensate a more acidic environment? Your lungs is going to dump off a lot of carbon dioxide. If I am dumping off a lot of carbon dioxide, we know that carbon dioxide is acidic in nature. So in that way, I'm trying to compensate the acidic environment inside your body by dumping off more of your carbon dioxide. So that's why I have written the statement that lungs help in your acid-base physiology. Lungs help in that. Am I right? Hello?
Yeah.
Okay. On the other hand, again, if the same person is having an acidic environment, how your kidneys are going to help? Your kidneys are going to make a lot of aldosterone. Aldosterone is going to kick off your H plus. In this way, it would try to compensate. It would just try to keep the pH in normal range. So that's why I have written this statement that kidneys also modulate in keeping or in maintaining your acid-base physiology, right? What else your kidneys can do? Your kidneys can also keep on reabsorbing more HCO3. If I am reabsorbing more HCO3, again, I already have written the balance formula, right? If you have acidic environment, how to correct it? Either dump off acid or either just take more alkalis in order to neutralize that. Am I right? Hello?
Yes.
Okay.
Yes.
Any questions till now?
No.
Any questions? You guys are open. If you guys have any questions, just ask me, because it's a kind of difficult for students, but I'm just trying my best.
Sir, I have
Mhm.
I have
Yeah,
a
sure.
question.
Mhm.
If someone is hiking and
they are hyperventilating, so they lose a lot of carbon dioxide.
Yes, they become
Then it's
alkalotic.
acidic. It would be alkalosis.
Mm-hmm.
Yes. So in body
Yes.
there will be less carbon dioxide, but uh, bicarbonate ions will be high.
Yeah,
Right?
you're okay. Yes, so bicarbs are going to be high. We are going to discuss those scenarios later, right? I'm like here now at a very basic level, right? We are going to move towards all of those scenarios: the hyperventilation, how hyperventilation, what's compensation, what's overcompensation. We are going to discuss all of the formulas. But till now, whatever I have taught you, is that clear? Okay, is that clear? Like,
Yeah.
let me just write down the summary. The summary for all of these things were that acids and bases normally in your body are in a balance, right? Whenever your balance is disrupted, there's going to be a lot of problem, right? And what controls our acid-base physiology? Two things: lungs. How do they control? They are going to change the level of CO2 in order to control. If I need acidic environment, you are going to hyperventilate. We are going to let more carbon dioxide stay inside our body, and your lungs is going to help us with that, right? So lungs is basically, lungs are basically important in keeping that balance, okay? On the other hand, we discussed that your kidneys also help in modulating your activities. How? They have both the abilities to, reabsorb HCO3 to excrete out your hydrogen. So in that way, all of our this chapter is going to revolve around two things: lungs, kidney, and how do they help us maintain our normal acid-base physiology. That's the main point of all of this discussion which I had. Okay, is it right?
Yeah.
Yeah.
And another thing which we discussed, that hydrogen have inverse relation with pH, right? As the pH increases, it means hydrogen decreases. Okay, it's an inverse relation, right? As the pH decreases, as the pH decreases, it means hydrogen increases. They have inverse relation. Is that clear? And what's the relationship of HCO3 or bases with the pH? It's direct relation, right? When the pH increases, it means we have more basic environment, right? If the pH decreases, we have less basic environment. Am I right? These are going to be your summary points, right? Just write it down with yourself. Okay, so let's just take our discussion a little bit further. Okay, so how to determine your acid-base disorders? It's the main thing which you should know, right? So on your questions, you're going to, whenever you see a kind of acid-based question, right? So there are certain steps which you guys have to follow, right? Those who do not have, anything to write it down, please take your pen and paper, and whatever steps I'm just writing down, just write it down with yourself. And whenever an acid-based question comes, just follow these steps. You are definitely going to answer the correct. Okay. First of all, whenever you have a question stem, right, about acid-base physiology, first of all, you have to look towards pH. What's the pH? What's the normal pH? Normal pH we already know is 7.35 to 7.45. If the pH is less, it's an acidic environment. If the pH is more, it's a basic environment. First of all, you have to look towards pH. Okay, just please repeat. What's the first step we are going to do in these questions?
Yes.
Look at the pH.
Look at the pH. Okay. Once you have looked towards the pH, then what else are you going to do? You have to look towards the normal values of carbon dioxide, the normal values of HCO3. Okay. So what is the normal value of your carbon dioxide? It's around about 40 mm of Hg, right, in your blood. Am I right? Hello.
Yes.
What's the normal value of your HCO3? It's round about, I would say, 24, right, milliequivalent per liter. Okay, so for example, I have a question. The pH is low, right? So the pH can be low due to different reasons. Either there can be some problem. Okay, what does low pH mean? Low
Acidity.
pH means acidity, right?
Acidity. Acidity.
So how can I get acidity? You can just assume I can get acidity if the lungs are allowing more CO2 to stay in the blood. Can I say that?
Yes.
Yes.
Can I say that? Or in
Yes.
other words, if lungs are hypoventilated. In hypoventilation, what we do in the respiratory depression, right? Like for example, I'm depressing your respiratory system. It means we are allowing more CO2 to stay in the blood. If we are allowing more CO2 to stay in the blood, it means we are making an acidic environment, right? Okay. On the other hand, what's the other probability of getting acidity? For example, if I'm decreasing HCO3, right? If I'm decreasing HCO3, the balance is disrupted. Again, you are going to be having acidity, right? Hello?
Yes.
But decreased acidity, decreased HCO3 have nothing to do with your lungs. It have to do with your metabolism, right? It have to do with your kidneys. It have to do with your metabolism. So whenever we have acidity due to lungs, we are going to call that condition as respiratory
Acidosis.
acidosis. Whenever you have acidity due to a metabolic problem, I'm going to call it as, yes,
Metabolic acidosis.
metabolic acidosis. What's difficult? It's simple, I guess, right? Okay. If I have just looked towards the pH and the pH is high, it means we have alkalosis, right? Now the next thing which you have to, look whether the alkalosis is due to any problem within your lungs or whether it's due to a problem within your metabolic activity, right? So when we have, let's suppose if our lungs are hyperventilating, it means we are dumping off a lot of CO2 outside into the environment, right? And we are getting alkalosis. Are you guys following me?
Yes.
So can I call this condition as respiratory alkalosis?
Yes, we can call.
Okay. If we have alkalosis, but now it's due to more HCO3. If inside the body I have, let's suppose your kidneys are reabsorbing a lot of HCO3. Let's suppose. So in that condition, I'm going to call it as metabolic alkalosis because it's due to a metabolic problem. Am I right?
Yes.
I think that's simple. Any questions? Any questions? Any questions? Hello, please respond.
No question.
Okay, perfect. Okay, so, okay. So let's just take our discussion further. First of all, if we have whenever we have an acid-base problem or an MCQ, we have to look towards pH. What else we are going to do? We are going to determine whether the pH is high or low. What's the problem going on? Is there any problem with metabolism or is there any problem with your lungs, right? So for that, you have to look towards the value of CO2. You have to look towards the value of HCO3, right? So the normal values, you have to keep that in mind. If you know the normal, you will know the abnormal, right? So if in this case, let's just take this case. We have acidity, right? And this individual was using, let's suppose, opioids, right? Opioids lead to respiratory depression, if you guys remember. You know?
Yes.
Okay, respiratory depression leads to hypertension. So in that case, what's going to be the value of your CO2? If I'm just, okay, in this case, I'm just, allowing more CO2 to stay inside the blood. So this value is going to be more, right? Is that right?
Yeah.
If it's a,
Yes, yes.
okay. And on the other hand, this value as a compensation, I'll be just discussing that, it would also get more, right? Because if we have, let's suppose, respiratory acidosis, right? I'm allowing more carbon dioxide. You have to look towards the normal value. Yes, value is more than CO2, right? And this value should also be increased, right? But if it was a metabolic problem, then it would be less than, in the question, you would see less value than 24. Is that clear?
Yes.
But there is a concept of compensation, which I'm going to discuss further. Till now, you should only know that. First of all, look towards the pH, look whether it's a respiratory problem, it's a metabolic problem, and then we are going to follow some other steps, right? Okay? Okay. So determine the primary disorder. Okay, calculate anion gap. What is anion gap? Okay. So whenever we have metabolic acidosis, right? Metabolic acidosis. Here things get complicated. How? If you have respiratory acidosis, simply you can just solve that MCQ. If you have metabolic alkalosis, you can solve that MCQ. If you have respiratory alkalosis, you can solve the MCQ. But whenever you come to a conclusion that we have metabolic acidosis. When do we have metabolic acidosis? Yes, whenever this HCO3 is less than 24, right? When HCO3 gets less than 24, that's going to be metabolic acidosis, right? Hello?
Yes.
Okay, perfect. Now you have to follow some extra steps. You have to follow some extra steps. And what are those steps? Keep that in mind. Sometimes what happens, sometimes there won't be any problem with your metabolism, but there can be some other problem. Sometimes some extra anions. Okay, what are anions? Anions are basically negatively charged molecules, right? Negatively charged molecules, if you guys remember your lectures from your school chemistry lectures, anions are negative, cations are positive molecules, right? Okay, so sometimes what happens that we have some extra anions and it keeps on accumulating inside your blood and they give you acidic environment, some extra anions. And obviously these extra anions are going to be present due to some extra, for example, if I'm taking something, right? I'll be discussing what things, right? Not now. But the concept here is that metabolic acidosis questions sometimes get complicated. Why? Because in the real-time scenario, sometimes we can have some anions, some extra anions inside our body present in the blood, giving us acidity. Okay? Hello?
Yes.
So if we have acidic environment due to some extra anion, some extra negatively charged molecules, I am going to call it as anion gap metabolic acidosis, right? Okay, normally we know that majority of our ions are your Na plus your, yes, what else? Your HCO3 and your chloride. These are the normal ions present inside your body, right? They're the abundant one. Okay, so these two anions are the common one present inside our body. Am I right? Hello?
Yes.
Okay, so normally what happens that whenever you take all of the Na present inside your blood, whenever you take it, okay, whenever you take all of the Na inside your blood,
Yeah.
just give me a second. Okay, so whenever you have an extra sodium present inside your blood, what we are going to do, we are going to take all of that Na and we are going to subtract all of the anions from it, right? We're going to subtract all of the anions from it, right? And in the end, we are going to have a number of 12. That's normal, okay? Okay? Hello?
Yes.
Okay, that's normal. But whenever this gap is more than 12, now you should assume that we have some extra anion which are contributing towards this acidosis. Is that clear? So, for example, whenever a question stem of metabolic acidosis appear, right? Like you have looked towards the pH, you have looked towards the values of CO2, the values of HCO3. We are going to be discussing a lot of MCQs. Everything is going to be quite clear to you guys. But now I'm just helping you, right? What we are going to do. So, for example, in the end, you have assumed that we have metabolic acidosis. Now, there's a question should come in your mind. Is it an anion gap metabolic acidosis or is it an non-anion gap metabolic acidosis, right? Am I right? So, in that case, what you are going to do, you are going to take all of the Na given in the questions, you are going to subtract it from all of the anions, normal anions. If the value is 12, that's normal. It's a non-anion gap metabolic acidosis. If the value is more than 12, it means we have some extra anions which are contributing towards this acidosis. Is that clear? Hello?
Yes. Yes.
Any
So
questions for now?
when the value is more, it means like the negative ions or anions are less, because
Oh,
according to the equation, like we see. Could you please explain this?
okay. Let me just tell you. For example, these are our Na, right? We have our Na and we have some of our chlorides, right? Okay, the normal ions, HCO3 and your Cl negative, right? So normally what happens that this gap, if we subtract both of them from one another, we have a value of 12. That's normal, okay? Okay, that's normal for every individual. Those who who do not have any metabolic problem, metabolic acidosis, like, okay, are getting it? There could be acidosis, but it would be a non-anion gap. There can be some problem with the, with your kidneys, with something else. But if the value get more than 12, it means that now we have some extra anions, right? We have some extra negatively charged molecules which are contributing towards acidity. That's simple. Is it clear now?
Yes.
Okay. Okay. We are going to discuss MCQs. So things are going to be like, really clear to you guys. Okay. Just okay. So before carrying out our discussion further, we have Dr. Nurul Mubin, right? Hello, Dr. Nur. Are you here?
Yes, Dr. Ahmed, I'm here.
So for all those who are old graduates, I'm seeing a lot of old graduates. Dr. Noor is a great motivation for them. Dr. Noor, can you just please share your entire story, how you prepared for your step, which resources do you use, how everything helped you. So I want all of you guys to get motivated for the next match cycle. So Dr. Mubin is here, a live motivation for you guys. Yes, doctor.
Yeah, so I am like as I said told in the group, I'm an old graduate. I'm a graduate of 2009, and I had been like on and off thinking about going for steps, but eventually, like last year, end of last year, I like decided to like take on to it, and honestly, I was like some of you guys, like or most of you guys, I was did not know what to do and where to start and stuff. But eventually, like I joined Dr. Ahmed's class, and then I was like guided like what to do and what not to do. So like it is like I mean, for like me being an old graduate, it was like a bit difficult, or like I would say a lot difficult for me, because it was the old concepts which I had like long forgotten and stuff, and I just needed to like review them. So joined the course, and I was like able to learn all about the basic concepts, which Dr. Ahmed like is by the way really good in like teaching. So like that helped me a lot. And then like about the resources, like they're like one is like UWorld is the main resource. We have to like do it, and we have to use it not as like our assessment, but as a learning tool. And apart from that, like the BNB videos and these like daily lectures and the first aid, these are all the like resources we need, and like nothing much more. So we just have to be like I was like consistent and like going on. I mean, during the whole process I had like many moments where I thought that I was lost and I don't know what to do, but I had help, I had guidance. And apart from that, like I just like think that I had to be consistent, and like be consistent about it was like the key. And I was able to do that. So in the end, I think that exam is like a very doable thing. It's not like that difficult. Yeah, the course is very like broad, and we have to like read a lot, but still it is like very doable. We can just comprehend it. And I mean, uh, what my understanding about this exam is that like it tests our like basics, like and
Moreover, if you have more gap, it's they're not taking into residency. Do you know that answer?
well, I have just like passed my step one. I'll like just do the step two, and then like take on that how I can get in or get not get out. But I mean, like I have been in clinical practice now that I have like this much gap. I
But the
am
gap you
a
need to take
surgeon by
yourself. What you're
profession.
doing.
I am a surgeon by profession.
Mhm.
and so I'll be aiming for like getting into that specialty.
Yes,
These
there are a lot of other things to keep in mind, doing a lot of researches. Dr. Noor is currently doing researches. We are going to cover all of those things
If
on
if you
that.
are a US citizen, then not a problem. But if you're not a US citizen, they will ask about the gap because you have too much of
yeah,
gap.
no,
They
like
might be asking.
there are multiple factors involved. You're very right. But the thing is that all those factors will come in play when I have done my steps. If I have not done them, then they don't count at all. So I'm just like
Yes,
taking this let's just complete steps and then we can do
okay.
what can be done.
Yes. So Dr. Mubin is definitely going to match in this residency. He's currently doing a lot of.
Dr. Mubin, can you please tell the real exam is like UWord or NBMEs
It
or
is more
Free
like it
120?
is more like NBMEs and pre 120.
But I heard ever heard that the question stems are very a large one.
Oh yeah, they're like really long. They're really long. That is like true. So you have to be on your
Yeah, if
toes
you
and you have
concentrate
to.
on U world more, then you should be fine to take the
I
test.
mean, if you ask me how the real questions are, so they are like the concepts and this type of questions they come in the exam. They are like very similar to NBMEs and pre 120. They are less similar to the U world, but yes, they are long, lengthy stems. They're more longer than the NBMEs. I mean, like 2 to 3 times longer stems. But the thing is that in those long stems, the information they have given, there's like most of the information is irrelevant to the question. They're like saying that this is normal, this is normal, this is normal, and the relevant information, which is like gonna get you to the answer, that is like not that much long. So the way Dr. Ahmed has guided us
But
that how to
in
approach
a
the.
medical school in US, they ask us to concentrate more on U world. I'm in the semester 4, so I'm taking my step 1. So usually we concentrate more on U world. Of course, NBME also.
Yeah, what I have learned about by the preparation and exam is that UWorld is basically a learning tool. It is not like exam assessment tool that we have to use that to learn about the topics. I mean, the explanations and all that stuff that helps to clear the concepts and stuff. But if you ask me that what the real exam was like, I mean, was it like the questions in the U world or was it like the questions in the NBMEs? Then I would say that the questions were more closer to the NBMEs than the U world.
can you please tell about the biochem, like biochem portion and microbiology portion? What was the question about that? Like, is too hard or
No,
what
it's
about
not too. I
Usually
mean,
biochemistry they don't ask so many questions. The whole
exam.
book you read, they
Hello,
hardly is like 10%. That's
Doctor.
all.
Okay,
Hold
Doctor.
on, hold on. Can we hear now, please, Dr. No? Go ahead.
Yeah, the biochem questions were they were more from the genetics and the metabolic disorders. From the general biochemistry and all the cycles and stuff, there were I mean, I guess two questions at most in the whole exam. But like the genetics and the metabolic disorders, like the enzyme deficiencies and all that stuff, like newborn babies with disorders of metabolism and abnormalities, there were quite some questions about it. So that is like something you have to learn, and the
O-
genetics also.
Okay, inborn metabolic errors,
Yeah.
inborn errors. Okay.
and what about the ethics one and
Ethics, I mean, I was also like hearing about that there are a lot of ethics question, but it was not like that. I mean, we did have ethics question, like about 3 to 4 ethics question in like every block, but not I heard like 7 to 8 questions. There were like 3 to 4 questions. They were like easy questions about ethics. I mean, the common sense questions, not like very difficult ones.
and what
Thank
about
you
the
so much.
biostat portion?
Mhm. Okay, so
Biostat.
okay,
Biostat,
Doctor.
there were like three, I mean, maybe 3 to 4 questions, I guess, in the whole exam. Not much, and like no very lengthy calculations or difficult difficult calculations.
Only 3 or 4 questions in the whole exam?
Yeah, whole exam.
Oh, it's quite less. I
Yeah.
thought like
Yeah, I
every.
know
Thank
it
you so
wasn't in
much.
my exam. It wasn't that much.
And
Oh,
what do you think in your exam? What was the main focus on the which system they have focused more?
The systems were like I can say that it wasn't like one system was more, one system was less. It was like equally. I mean, the as you expect from the systems, they were like the weightage was like the same. I mean, it wasn't like that whole exam is like about CVS or whole exam is about like respiration or neurology. They were like evenly distributed. Uh,
Okay,
apart,
but we have heard about the experimental questions, like how we can know that it's an experimental questions. Like,
I mean, we can never know, but the thing is that the questions, like, there were not any questions which, yeah, I can say that they were like out of the blue or they were like very odd questions, and I could say that, oh, I mean, I have not heard of that at all. I mean, these like questions, they can were like at most like 5, 6 questions in the whole exam, not more than that.
Thank you
okay,
so much, Dr. Noor,
thank you so
for
much,
your
and
And yeah,
congratulations.
one thing I would like just like to emphasize was that like there were a lot of questions about from microbiology, a lot of questions about the fungal infections. I mean, that is a small topic, but it was like heavily tested.
Okay. So Dr. Mubin is already there in the group. If you guys have any queries, he'll be there. He can just sometimes come. He can just answer your questions. Thank you so much. It Dr. Mubin is a great motivation for us. So Dr. Mubin was like in the marathon. So Dr. Mubin, can you just tell us that how does this marathon help you in your journey and everything?
Oh yeah, it helped me like a lot. It was an excellent experience I had. I mean, apart from like learning and teaching and stuff, it was like the whole process was like very helpful to me. As I like said before, that I had like no idea before like starting when I started that how the process is gonna be, how am I gonna prepare, what resources I like need, and how am I gonna like progress in my prep. So I got all the guidance from here. That what am I gonna do, what am I not gonna do. So it was like a great help. That's for sure. I mean, that's what I can say.
Thank you so much. So all of you guys should be, confident that we are on right track. Inshallah, one day you guys are also going to share your reports here in the group. You guys are going to pass your step one, not even step one, step two, step three, and you are going to get into your residency. Thank you so much, Dr. Noor. We are
Thank you very
just,
much,
looking
Dr.
forward for
Thanks a
your
lot.
residency this year, inshallah. And you are going to be, there in our step two marathon, and all of our mentors are going to help you with that. Okay, thank you so much.
Thank you very much. You're welcome. Allah Hafiz.
Let's continue our session further, and let's discuss acid base. Okay, so as we mentioned, okay, so where were we? We were at anion gap metabolic acidosis. Is everything cleared? Any questions till now? Hello?
Yes,
Hello?
please.
Hello?
No, I don't have any.
Okay. Okay. So let's just okay. Another thing which you should just keep in mind. For example, if I have, let's suppose, a problem going on with within the lungs, right? Let's suppose if we have respiratory acidosis. So what does respiratory acidosis mean? We already discussed. If the lungs are hypoventilating, if you are hypoventilating, we are allowing more carbon dioxide into our blood. It means that we have respiratory acidosis. In that condition, your kidney is going to help, right? And how the kidney is going to help? It's going to dump off more H plus in order to get that balance, right? For example, if we have problems with the kidneys, so then your lungs are going to help. So it's basically a kind of compensation. Like both of them are good friends, your kidneys and your lungs. Whenever, like they're best friends, I can say, right? Whenever your kidneys are in trouble, it's causing trouble to your body, your lungs are going to help that. Whenever your lungs are in trouble, they are just causing problems, your kidneys are going to help, right? So that is basically known as compensation, right? Is that clear? So we are going to discuss some questions now. I want you guys to take your pen and page and just, answer this MCQ, okay? So the first example which we are going to discuss, example 1. Okay? Okay, so I want someone, okay, let me just pick someone for this question. Okay, Dr. Michelle. Dr. Michelle, are you here? Hello? Dr. Adonia? Hello?
Yes.
Okay, so this question is for Dr. Adonia. We have an individual with pH of 7.31, right? His HCO3 concentration is 28, or the value, and his PCO2 is 48, right? So what do you think what's happening here?
So they're having, so you have
What's
to
the
look at
first
the,
step?
you have to look at the pH first. So it's less
Okay.
than 7.35. So it's acidosis.
Okay, perfect. It's acidosis. What's the next step? You are going to find whether this acidosis is due to any problem with the lungs, whether the lungs are causing this acidosis, or whether you have a metabolic problem, right? So what
Yeah.
next step are you going to do? You have to look towards the value of
Carbon dioxide.
carbon dioxide. So is carbon dioxide more or less? What's the normal value? 40, right?
Yeah, it's 40. So
Okay,
that
so
means it's high. Carbon dioxide is high.
okay, now you have to look towards the value of HCO3.
And normal HCO3 is, that was 24, right?
Okay,
So that means the HCO3 is also high too.
okay. So what do you suggest? Is it a respiratory acidosis or it's a metabolic acidosis?
It is, I would say, a respiratory acidosis.
Yes. If it was metabolic, then the value should be less than 24, right? But
Yeah.
we have value more. Why? Because now you are having compensation. Your kidneys are compensating. You have acidosis, right? Your respiratory acidosis. Why? Because the value is 48, more than 40. And as we find acidosis there, how your kidney is going to compensate? Your kidney is going to reabsorb more HCO3 in order to compensate this acidic environment, right? So that's why the value is little bit higher than 24. Is that clear? Hello? Is that clear?
Yes, clear.
Can you repeat it?
Perfect.
Sorry, can you repeat it? Can you repeat it, Dr. Ahmad?
Okay. Okay, so what's the first step? Look towards the pH. pH is 7.31. It's less than 7.35. It means it's acidosis, right? Okay. Hello?
Yes, yes, yes.
What's the next step? You're going to find whether it's a metabolic acidosis or whether it's a respiratory acidosis. Okay, so you have to look towards the value of HCO3, the value of PCO3. Whenever we are having metabolic acidosis, it means that the HCO3 should be less than normal, right? Less than 24. Whenever we have less than 24, less than normal, then in that case, you are disrupting the balance. You are having more H+. Then it would be your metabolic acidosis. But in this case, it's not a metabolic disorder because the value isn't less than 24, right? On the other hand, the CO2 is more than 40, right? If it's more than 40, it means it's problem. Your lungs are hypoventilating. Your lungs are hypoventilating due to certain reasons, like for example, it might be opioid use, it can be benzos use, it can be anything like that, okay? Which is going to lead to more CO2 staying inside your body, giving you respiratory acidosis. But as I already mentioned, if your lungs are causing troubles, your kidneys are going to help that. Your kidneys are going to compensate that. How your kidney is going to compensate? More acid. If I have more acid, it means I have more H+. So how to compensate it? Reabsorb more HCO3, right? So you guys can see the HCO3 is more than 24. Is that right?
Yep.
Yes.
Okay. So it is basically respiratory acidosis with a little bit compensation from your kidneys. That's all. That's so simple, right? Okay. Let's discuss our next scenario, right? Our next scenario is for Dr. Nahid. Dr. Nahid, can you please turn on your mic?
Yes.
Okay. So, for example, we have an individual with pH of 0.25. His HCO3 concentration is 11, while his PCO2 is 24. What's the first step? Dr. Nahid, what's your first step?
pH is low.
Okay, so pH is low. Is it acidosis or is it alkalosis?
Alkalosis.
Hmm?
Oh, acidosis.
Sorry, acidosis.
Acidosis because it's less than
This is low. It is
7.35.
acidosis.
Yeah.
It's acidosis, as we already mentioned. We have less pH mean more H plus. More H plus mean acidosis because pH is having inverse relation with your H plus, right?
Yes.
Okay, so it's acidosis. Now you have to find whether the acidosis is due to respiratory problem or metabolic problem. So what's the next step? Look
Values of
towards the
CO2
CO2,
has to go.
right? If it was respiratory acidosis, then the CO2 is supposed to be more higher than 40, right? Is it higher than 40?
No.
No.
That is less.
Okay, let's look towards HCO3. If it was metabolic acidosis, the HCO3 is supposed to be less than 24. Is it less than 24? Yes, it's
Yes.
less than 24,
Yes.
right? It means it's a metabolic.
Acidosis.
But whenever we have metabolic acidosis, things get complicated. You have to find whether it's anion gap metabolic acidosis or whether it's a non-anion gap metabolic acidosis. So let me just give you the values. Your Na in this case is 138. Your chloride in this case is 110. And your HCO3 is in this case is 10. What do you think? Is it a metabolic, is it an anion gap metabolic acidosis, or it is a normal anion gap metabolic acidosis? Yes, please calculate it. I just already told you the formula. Take all of your Na plus, subtract all of the negative anions which are normally present in your body, HCO3 and Cl negative. What's the value here? Yes.
18.
The NN gap is normal.
Okay,
And
what's the
then
value?
more than
12.
it's 18.
It's 18, right? It means it's more than 12, right? 4 values more than 12. Am I right?
Yes.
It means that now we have some extra anion which are contributing towards this acidosis. So it's going to be anion gap metabolic acidosis. Am I right?
Yes.
Okay. So Dr. M.A.K. Makalselman. Okay. Sorry, I can't pronounce your name. The next question is for you. Okay.
Yes.
Your pH is 7.15. Okay. Your HCO3 is 9. Your PCO2 is 38. What do you think? What's happening? What's the first step?
So according to pH value, it's 7.15. So it's an acidotic pH.
Okay. What's the
And
next step?
Next step, we have to see the bicarbonate and PCO2 levels. The bicarbonate level is less than normal, so it's a metabolic acidosis.
Okay, it's a metabolic acidosis. And whenever we have metabolic acidosis, again, what we are going to do?
Anion gap. We have
Anion gap, right? So for the anion gap, you have to take all of the, okay, so this individual again is having same values of your, these. So again, he's having anion gap metabolic acidosis, right?
yes.
Okay, is that clear? So,
Yes.
and we have some kind of compensation as well, right? You can just see the values. So this was all about the acid-base questions. Now let's go a little bit deep into different conditions, right? That was all, right? So you guys have grabbed each and everything about these MCQ, but I want to go a little bit specific that what things can cause acidosis. You know the concepts, right? The next discussion is going to be quite easier for you guys. Okay, so let's discuss metabolic acidosis. Okay, so who is going to be telling you what is metabolic acidosis? How can it occurs? Yes, Dr. Maksalmina. Can you just please tell us?
Regarding metabolic acidosis.
Regarding metabolic, what is metabolic acidosis? Everything, right from the start. Now we are your students, you are our teacher.
So in case of metabolic acidosis, as it's acidosis, the pH level has to be less than 7.35.
Perfect.
And then we have to look for since it's a metabolic acidosis, the level of bicarbonate has to be less than 24.
Perfect. But as a compensation, what your lungs are going to do?
As a compensation, our lung has to do bradypnea, like
hyperventilation, right?
No, hypoventilation.
Hyperventilation. We have
Hyperventilation. Oh,
acidosis.
yes.
We have
In case of
acidosis.
Mhm.
And how your
In
lungs
case
is going to help? It's going to hyperventilate. It's going to try to dump off more acids, more carbon dioxide, right?
Yes, yes.
Okay, perfect. Then, if it's a metabolic acidosis, we have to calculate whether it's anion gap or whether it's a normal anion gap, right? For that, we have to use a formula. So, as I already mentioned, if the value is more than 12, it means we have some extra,
Lines.
extra anions which are contributing towards this acidosis. And what are those extra anions? The for that is, or the mnemonic is mud piles. What is mud piles? Methanol, formic acid. For example, if someone is taking formic acid, methanol, it can cause anion gap metabolic acidosis, right? But with that, the history can also give you a lot of things. Methanol normally causes some visual symptoms, right? So if you have an individual, he's having same condition, metabolic acidosis, and in the question stem, they're just asking you have ingested something, they aren't mentioning with some visual symptoms. So what should come in your mind? This individual is consuming methanol, and that methanol is giving these extra anions, which is contributing towards your metabolic acidosis. Is that clear?
Yes.
Hello? Perfect. Okay, now we have an individual. We have metabolic acidosis. You calculated all of the formula. It was an anion gap, but that individual is having chronic kidney disease. What do you assume? These extra ions are coming from
Cause of
That's
uremia. The cause of
uremia. Perfect.
Mhm.
Uremia, we already know whenever we have kidney disease, chronic kidney disease, what's the function of your kidney? It's going to, dump off urea, right? Urine. It's going to produce urine. It's going to dump off your urea. If you have chronic kidney disease, urea cannot dump off. It will just keep on accumulating in your blood, and it's going to give that extra anion. It's a negatively charged molecule. Simply you can assume that, right? And that extra anion is going to contribute to anion gap metabolic acidosis. Is that clear?
Mhm. Yes.
Okay. So the history can also give you a lot of things. Okay, let me just give you a scenario. A 55-year-old patient with a past medical history of poorly controlled diabetes, CKD, hypertension. He's having metabolic acidosis. What do you assume? It's
Diabetic.
uremia, right? It's type 2 diabetes, not type 1. Hello? Hello? Okay.
In
So-
case of
Okay, in case of type 1, we were having DKA, right? DKA was complication of type 1 diabetes, if you remember, right? You are having ketones. It can also lead to metabolic acidosis. But here in the question stem, they are mentioning that we have type 2 diabetes, right? So you have to look towards that. If it was type 1 diabetes, so you are correct. Type 1 can lead to DKA, diabetic ketoacidosis. It can make a lot of ketones. And those ketones are then going to be these extra anions contributing towards metabolic acidosis. Is that right? So methanol can do it. Methanol, your uremia can do it. Your DKA can do it, right? It can just contribute to those extra anions, which can give you metabolic acidosis, right? Hello?
yes.
Hello? Okay. Propylene glycol. Propylene glycol can also give you metabolic acidosis. Along with that, iron or isoniazid can also give you metabolic acidosis. Lactic acidosis can also give you, like if the lactic acid keep on accumulating, that can also contribute to those extra anions giving you metabolic acidosis. Similarly, ethylene glycol and salicylates, right? All of them can give you metabolic acidosis. So the mnemonic for that is mud piles. Mud, M for methanol, U for uremia, D for your DKA, P for propylene glycol, I for isoniazid or iron, L for lactic acidosis, ethylene glycol, and salicylates. Is that clear? Hello?
Yes, clear.
Yes.
Perfect. Okay, now if we have an individual, he's
Dr.
having-
Ahmed, could
Yes,
you
please.
just repeat one more time this thing causes one more time, please?
Okay, what should I repeat?
This mud or something. I
Abbreviation.
Okay.
The mud piles. Mud
This
piles.
is
And
mud piles. Okay, so simply you can go to
And
your
Dr.
first
Ahmed, before you continue, when do we likely use what is it called? Iron gap.
Anion gap. Whenever we have
Yes.
metabolic acidosis, whenever you just see a question, you assume that it's a metabolic acidosis. Then what you are going to do? Then you are going to calculate the anion gap. You know the formula. We are going to take all of the positive ions, subtract it from the negative ions. If the value is 12, that's not any problem, right? If the value is more than 12, it means that now you have anion gap metabolic acidosis. But if the value is 12, right, it means you have metabolic acidosis, but it isn't due to those extra ions. So in that case, it's basically it can be due to Addison disease. What happens in Addison disease? Yes, we have destruction of your adrenal cortexes, right, or medulla, right? So what happens? You won't be having aldosterone. If you do not have aldosterone, your H plus is going to stay inside your blood, and as your H plus stay in your blood, it's going to lead to acidosis. That is going to be a metabolic acidosis. Is that clear? But that's a normal anion gap metabolic acidosis. So the causes for anion gap metabolic acidosis are different. The causes for normal anion gap metabolic acidosis are different. Is that clear? Hello?
Yeah.
Okay. So for the normal anion, it can be due to hyperchloremia, right? It can be due to Addison disease. It can be due to renal tubular acidosis. It can be due to diarrhea, because diarrhea also lead to a lot of loss of HCO3. In diarrhea, you just lose a lot of bicarbs, right? It can lead to acidosis. Similarly, acetazolamide, it would inhibit the reabsorption of HCO3. We are going to discuss all of these cases further, right, in our pathology section. So it would be better if now you only remember the causes for normal anion gap, and the details are going to be discussed in our further lectures, okay? So you can just open your first aid, you can just memorize the mud piles, you can just memorize the cause of normal anion gap metabolic acidosis and anion gap metabolic acidosis. Is it clear? Hello?
Yeah.
Hello? Okay, so then you have your metabolic alkalosis. Okay, who is going to be telling us about metabolic alkalosis? What is metabolic alkalosis? Right from the beginning. Yes. Hello? No one?
So the in the metabolic alkalosis, the pH, first of all, the pH will be high.
Okay, perfect.
And we will look for the bicarb. Bicarb will be high.
And how would we be having compensation in case of metabolic?
We have to look for the lungs, and the respiratory carbon dioxide will be high.
Okay, so how it is going to become high? Your lungs are going to hypoventilate, right?
Because of the hypoventilation. The lungs will compensate by hypoventilating, so retaining the carbon dioxide, and that's the compensation for the metabolic alkalosis.
Perfect. So what are going to be the causes for metabolic alkalosis? Hypovolemia, right? If we have hypovolemia, what happens that we are going to have volume contraction alkalosis, right? We'll be discussing that as well in our further lecture. Similarly, use of loops or thiazide diuretics, right? Again, whenever we are using loops and thiazide diuretic, we are causing hypovolemia. That can also lead to contraction alkalosis. So we are going to discuss what is contraction alkalosis, right? Similarly, if an individual is vomiting, if we are vomiting, it means we are losing a lot of acids, right? Because inside our vomit or inside our stomach, we have acid, right? HCl. In that case, again, it's going to be a metabolic alkalosis, right? Okay, so all of these causes are going to be discussed further in our lectures. Till now, if you know what is respiratory acidosis, what's compensation, what's everything is going to be clear, right? Then we have respiratory acidosis. We know what happens in respiratory acidosis. First of all, it's acidosis. pH is going to be less than 7.35. And in that case, if it's a respiratory problem, it means problem is in the lungs. Your lungs are retaining more CO2. How to compensate it? Your kidneys are going to reabsorb more HCO3, right? In order to balance that acids, right? Hello? Yeah. And what are the causes of respiratory acidosis? Okay, what leads to respiratory depression, COPD, lungs diseases, opioids use, myasthenia gravis, anything which is weakening your respiratory muscles is going to lead to hypoventilation. Hypoventilation in turn would lead to respiratory acidosis. Is that clear? Okay,
Yes.
so the last one is respiratory alkalosis. What is alkalosis? pH is going to be more than 7.45. Okay, and if it's a respiratory problem, it means that your lungs are losing a lot of CO2, right? And as a result of compensation, what your kidneys are going to do? Kidneys are going to dump off your alkalis, HCO3, right? Hello? And how can we get, how can we get hyperventilation? Because the respiratory alkalosis is basically due to hyperventilation, right? If you are losing CO2, it can be due to in a panic attack, a person is hyperventilating, just like that. Okay, so if we have cancers, if we have high altitude, as doctor already mentioned, in high altitude, what we are going to do? We are going to hyperventilate. We are going to lose CO2. In that case, we are losing CO2. We are remaining the alkalotic environment. It's respiratory alkalosis, right? Similarly, pain. Pulmonary embolism can do that. We are going to discuss pulmonary embolism. How do it cause respiratory alkalosis in a big detail, okay? So for now, you can just only remember the causes, okay? And that's all about acid-base physiology. Is there any questions?
Thank you, Doctor.
Hello?
Thank you.
Dr. Ahmed, I have one question.
Okay, yes.
So as you said, like in case of metabolic acidosis, we are going to calculate it. There would be any iron gap or not. How about others like metabolic?
Yes, that's that's the best thing about this entire conversation. Whenever you have metabolic acidosis, then you have to calculate an iron gap. Nothing in else condition you have. That's very simple. Only the concerning one is your metabolic acidosis, right? Thanks God that other are simple. Okay.
Okay.
Okay. So that was all about today's lecture. Hope so you guys enjoyed. If you guys have any question, just tell me. Okay. Hello. Any
Okay.
questions? Okay. Let's have a brief summary of today's discussion. Okay. Do you want you guys to summarize this? Hello.
Yes,
Okay.
doctor.
Yes, please.
Let's have a summary. Okay. Do you guys have your first aid book? Just kindly please turn keep open your first aid book. Okay. And from the first aid, we are going to read these like this entire acid-base physiology, and then things are going to be really clear. Okay. So there is a chart mentioned in the first aid book. That's really amazing chart. And if you have in-depth knowledge, so that's going to be a best review chart for you guys. Okay, so let me just open my first aid. Hello. Have you guys opened your first aid? Hello.
Yes.
Yeah.
Perfect. Okay, so you guys can see on 610 page, right? So there is a chart mentioned and everything is there. Okay, so let's discuss that chart. Okay, so they have just told you check arterial pH. If the pH is less than 7.35, you can see it's acidemia, right? On the right side, if the pH is more than 7.45, it's alkalemia, right? Okay, so if now you have acidemia, you should think of whether the acidemia is due to respiratory problem or metabolic problem. For that, we have to look towards the value of CO2. We have to look towards the value of HCO2. In case of respiratory acidosis, CO2 is supposed to be greater than 30. Am I right? Hello?
Yes.
Okay. In case, okay, if it was a metabolic problem, the HCO3 is supposed to be less than 24. There they have mentioned 20, but the value is 24. Keep that, okay? Keep that in mind. But if it's a metabolic acidosis, things get a little bit complicated. You have to calculate whether it's an anion gap or non-anion gap, right? Or normal anion gap. If it's greater than 12, these are going to be the causes. Mud piles. They have just, a mnemonic gold mark, but it's a mud piles, okay? So it can be due to glycols, oxoproline, it can be due to lactate, delactate, it can be due to methanol, it can be due to aspirin, renal failure, ketones, DK, right? Okay. If the value is normal, it lies in between 12, it's going to be due to spironolactone, it can be due to Addison disease, renal tubular acidosis, diarrhea, saline infusion. We are going to discuss the details of each and every one. How do it lead to metabolic acidosis? Similarly, if you have respiratory acidosis, it's due to hypoventilation. We are allowing more CO2 inside our lungs, which is leading to respiratory acidosis. On the other hand, you can see alkalemia, right? If it's a respiratory alkalosis, it means that the PCO2 is going to be less than 40, right? And if it's a metabolic alkalosis, it is supposed to be more than 24, right? So here you guys can see hyperventilation can do that. Anxiety, panic attack, hypoxemia, salicylate, tumor, pulmonary embolism, pregnancy, right? All of them, these conditions leads to hyperventilation. Just keep that in mind. On the other hand, you have to check urine chloride, right? So whether it's a salt, saline resistant or saline responsive. So it's going to be a topic for our next day, right? But for today, it was all about our acid-base physiology. Did you guys enjoy the session today?
Yes, it was
Yes,
very
Doc.
good.
Thank you so much. Thank you so much.
Thank you.
Okay. Thank you so much. Why do we have so less participants today? You know, I was just expecting a lot of participants. We only have 16. What's happening?
Because it's late, like it's in
Because it is late.
it's 1
Okay.
a.m. places.
Oh, really
Yeah.
sorry for that. Okay,
it's
so Dr.
1
Moaz, okay, so you'll get the recorded sessions. Actually, Dr. Moaz, maybe he have some work that's why he couldn't join. So I was starting the session. Okay. So thank you so much. Please drop your feedback in the group if you enjoyed today's session. As you know, Dr. Adonia just requested me to take a session on acid base, so it was a session on on demand. And so I need your feedback in the group if you guys enjoyed. Thank you so much.
Thank you, Dr. Ahmed.
Thank you so much.